Hello, my dear friends. I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for more than 25 years and I love it. What are we studying today? Inlet of larynx. This is your epiglottis, and these two, my fingers, represent the aryepiglottic folds. Can you see that? Between the epiglottis and my fingers, okay, there is a clear foramen created. I'm going to show you with this pencil. There's a clear foramen created. This foramen that gets created is called as the laryngeal inlet. Can you imagine that this is the space through which air enters into your larynx every day? Every minute that you breathe, air is passing through this little gap, in and out, in and out. See, epiglottis, aryepiglottic folds, and air passing through, in and out. Okay, so this is the gap or the laryngeal inlet through which larynx communicates with the pharynx. Clear? Pause the video if you're not clear about this because this is very, very important. Okay, so now let's try and breathe. So you have started to breathe in air. As the air enters into your pharynx, okay, it finds an inlet there. It finds the laryngeal inlet here. It quietly passes through the inlet into your trachea. Do it. Feel your trachea here and take a deep breath. Can you feel the air passing through? How has the air passed through? It has passed into your nose. It has entered into your pharynx. It has passed through your pharynx, through the inlet into your trachea. So the inlet is the entry point through which air enters into larynx, then into trachea, and then into your lungs. So inlet has to remain open. What will happen if your inlet closes? You cannot breathe. Okay? Fine. So let's talk about the day you started to eat something. Let's suppose you're eating something. Okay? So here's your inlet. Note the inlet. Okay? You have started eating something, whatever you like. Okay? So food has entered into your pharynx now. Okay? Now food has got options. Food can pass through the inlet into your trachea. It can pass directly down through the pharynx into the esophagus. But do you want your food to enter into your trachea? Definitely not. So what are you going to do? But inlet is there. Food has got both the options. What you need to do is to close your inlet. Whenever you're eating, the inlet of larynx has to close. Then only food enters directly into pharynx and down into your esophagus, which is the right way for the food to go. Clear? So with this, we come to a question of laryngeal inlet opening and closure. What opens your laryngeal inlet? What closes your laryngeal inlet and why? Clear? So that's the reason why we were studying so much anatomy. Okay, so the inlet of larynx, let's learn the boundaries first. Bound anteriorly, you've seen that. This was the epiglottis. These were the aryepiglottic folds. So you already know the boundaries. Let's just put it on the screen. Anteriorly bound by the epiglottis. On the side bound by the aryepiglottic folds containing all this. And posteriorly bound by interarytenoid mucous membrane. I'll show you all this. Just remember, this contents of aryepiglottic folds is something you have to learn. Go back and revise. I won't keep revising it, otherwise it gets very boring and the video becomes very long. Okay, so let's look at this. Orient yourself. This is your epiglottis. You're looking at the whole epiglottis, which means you're looking at it from posteriorly. Very nice. This is your tubercle of epiglottis. These two are your pair of arytenoid cartilages sitting on the lamina of cricoid. Okay, now, as you can see from the tip of arytenoid, a muscle is going towards your epiglottis. From the tip of arytenoid, a muscle is going to your epiglottis. This muscle is called aryepiglotticus. We've done this, so I won't do it again. Aryepiglotticus, from arytenoid to epiglottis. It is covered by mucous membrane, forming the aryepiglottic fold. Fold are mucous membrane. Muscle lies below them. And attaching the two folds to each other is the interarytenoid mucous fold. So these two arytenoid cartilages are attached to each other over here, okay, by a mucous fold called interarytenoid mucous fold. As you can see, we have developed a little foramen, isn't it? This one. And it is through this foramen that every day you breathe in, breathe out, breathe in, breathe out. Okay. So this is the laryngeal inlet, and these are the boundaries of laryngeal inlet. Now my question is, let's revise it quickly. Anteriorly epiglottis, on the side aryepiglottic folds containing two muscles, two cartilages, one membrane, and posteriorly interarytenoid mucous membrane. Clear? Okay. Now, how do you open the inlet? How do you close the inlet? Remember, this was your epiglottis here, and these were the two aryepiglottic folds with the tubercle here. Clear? So what happens is, when you want to close the epiglottis, the arytenoids, literally the aryepiglotticus muscles crumple towards the tubercle, and then the epiglottis bends a little bit. I want you to understand this carefully. Think, epiglottis, tubercle in the center, aryepiglotticus muscles on both sides. When they contract, they literally crumple towards the tubercle. Okay? A lot of people believe that epiglottis would fall back and close like a lid, but it doesn't happen. Even if you cut off the top of epiglottis, the inlet continues to close and open automatically. So the epiglottis is not a lid. The aryepiglottic folds are just crumpling towards the tubercle of epiglottis. That is why tubercle of epiglottis is important. Okay. So how does inlet close? By contraction of aryepiglotticus muscle. Pulling the aryepiglottic folds towards the tubercle of epiglottis. How does laryngeal inlet open? It opens basically by just recoil. Just the recoil causes the inlet to open with a little help by thyroepiglotticus muscle. So let's finally revise what are the actions of aryepiglotticus and thyroepiglotticus. Aryepiglotticus causes closure of inlet. Thyroepiglotticus assists in opening of inlet of larynx. Why do you want to close inlet? Because you don't want food to enter into your larynx when you're eating. Okay. Why do you want to open the inlet of larynx? Because you are breathing, living human being. You need air to enter through the inlet into your larynx, trachea and lungs and out again. So most of the time you want your laryngeal inlet to be open. You want it to close whenever you're eating food so that food does not enter into your larynx. So if you're liking my lectures, do like and subscribe to my channel.